This healthcare Bill of Rights is all about shifting power from the insurance companies to the citizen. Right now, insurance companies can deny you insurance, they can dump you when you become sick or injured, and they can certainly discriminate against you along the way. This Bill of Rights changes that. This creates fair market for citizens.
The right to buy insurance if you have a pre-existing condition, extremely important. We've all heard the stories and we will hear them again today. The ability to keep your insurance if you get sick or injured. How many times I've heard from constituents of mine who've been paying in all their lives for their insurance. They think they're covered, they think their family's covered, then somebody gets sick and they get dropped on a technicality. That's just plain wrong. Then we go on to health insurance without lifetime limits on coverage. Affordable insurance if you lose or change your job. In my state, where we have the highest unemployment rate in the country, it's critically important to me that if somebody loses their job, they don't lose their insurance, that they have the ability to find affordable insurance for their families instead of seeing what happens today with bankruptcies and people losing their homes.
Keeping your insurance if you become sick or injured. This is the anti-dumping provision. How outrageous is it that citizens who have paid premiums for 10 or 15 years suffer an injury or an illness, and then a few months later when their insurance comes up for renewal, it's denied and they are dumped? Well, this will apply to all new policies starting in 2010. No lifetime limits on coverage. It will apply to all new policies starting in 2010. Young adults being able to remain on their parents' insurance until their 26th birthday. Apply to all new policies starting in 2010. Preventive care without copays, without fees, without costs. Again, applies to all new policies starting in 2010.
What I heard in my town hall meetings over and over again was, tell us what's in this. Keep it simple and help us understand. What you heard from both Senator Stabenow and Merkley is why we have the Bill of Rights here. To make it very clear to Americans, to Alaskans that I represent, what they get in a basic and simple form.
We want to make sure that the insurance company does not stand in the middle between your doctor and your family. That you get what you're paying for, that you can find affordable insurance, and that business as usual with insurance companies and the unfair practices that have been going on come to an end. So the Healthcare Bill of Rights is about making sure Americans know that we're going to change business as usual for the insurance companies.